Okay, so to kick off the second half of our presentations, I would like to welcome Dr. Greg Wideman. Greg is a vet and a partner at Southwest. Greg's been leading our clinic's efforts in understanding high sow mortality across the industry. Today, Greg will be discussing sow mortality in Ontario, and specifically how we can manage prolapses on farm. Please join me in welcoming Greg.
Thank you, Jordan. Thank you very much. Can you hear me at the back there, Jim? I'm coming through. Wonderful. That's great. Well, as has been said already, thank you for joining us. It is very pleasant to spend this afternoon with you here talking about pigs. And I have good news to share in the next few minutes here. So I'm pretty excited to deliver this talk on sow mortality and prolapses. Just 3 topics for the next half hour or so. We're going to review some sow mortality trends, and we're going to do that here in Ontario and also further abroad. We're just going to spend a few minutes glossing over a few of the common causes of sow mortality, and then we're going to dive a wee bit deeper on this really annoying problem of pelvic organ prolapses and tell you about some new things we've learned there, okay? So I said I have good news, but it's not all good news in the pig industry. Everyone is aware that sow mortality is on the rise. And for those of you at the back, this is a chart sent from our friend Brad Eckberg at Meta Farms. He's got this updated now to 2023 year to date. And it is a 15-year trend on sow mortality in their data bureau in the United States. And it is showing an obvious increasing trend, with this most recent time period up over 15% sow mortality. It is really hard to hit your targets with 15% sow mortality. The exact same trend across the street at their competitor, Pig Champ. This is another several 100,000 sows, mainly in the US, not exclusively, showing just a really unpleasant trend in sow mortality. And this is the reality of sow production globally. We hear the same thing occurring in certain parts of Europe and in certain parts of Asia. That brings us to Ontario, and I want to show you what the data that we collect at Southwest is showing about sow mortality. So this is your data. It's anonymous. You won't see your farm name up here, but we have taken the data from our Pig Nose Bureau. I know some of you are on other programs. This is just Pig Nose. And we have about 200 farms on Pig Nose. We've removed some of the farms for this analysis. So we took away the farms where we thought the data was incomplete, not up to date, or where there was some strange problems appearing in the data, as there sometimes is. We've only focused on the Ontario farms, so we took away farms from other countries and provinces and overseas farms. And then actually a number of farms have either done a depop or a repop or a big expansion or something like that in the last 5 years. And we took those out of this analysis too, because that really messes with the denominator when we're calculating sow mortality, okay? But here's the good news. If you look at that gold bar on this graph, that is the mortality on 150 farms, about 175,000 sows in Ontario. And as you can see, it is flat from 2018 through this year so far. It's right around 8%. Okay? So the global pig industry should be beating a path to Ontario, to your doors, to understand how you're keeping sows alive, because you're doing a better job of keeping sows alive than anyone else. So well done. There's a couple other pieces of data on this chart I'm going to point out, and we always get this question, okay, is mortality due to loose housing? Or what's the impact of housing? And so we've got two other colors of columns here. The group housing in that kind of oat color did show an increase from 2018 to 2020, and then a slow, subtle decline since then. The blue bar, which is stalls, started very, very low, around 6%, and then in the last couple of years appears to be going up a little bit. Now keep in mind, it's only gone from 6 to 8%, so it's still just really I'm going to say a fraction of what's being experienced in some other places. But it has kind of defied what we would think maybe is the trend and the problem with loose housing. Now, there's a whole bunch of farms that actually have been through a transition, right? So this is actually only a fairly small subset of all the farms, and we won't focus too much on that on this slide. I just want to look at this another way, and I know you guys at the back have no hope of reading a single number on this, so let me just tell you what we're looking at here. This divides the sow mortality by herd size, and way over there on the left we've got a bunch of different categories of herd size from less than 100 sows up to more than 3,000 sows. And there's only two quick things I want to show you or say about this chart. Number one, there's not very many farms left in Ontario with less than 100 sows. There was 24 farms back in 2018, and now there's only 16. So farms are getting bigger. That's not a surprise. You all know that. But more importantly, and back to the topic at hand here, sow mortality is pretty flat no matter what the herd size is. There's one data point here back in 2022 where average sow mortality for 7 farms in the data over 3,000 sows, it popped up over 10%, but it looks like it's back down again here in 2023. So it's a good news story. Well done. Okay, again, some small font here, but these next 2 pages are just going to answer the question a little bit. When do the sows die, if they die or are destroyed? And if you look at that chart in the top left, that is days of lactation. And so for sows that die during their lactation, most of them die right at the very beginning of that graph. That makes sense, right? Farrowing is a significant event for a sow. It can be where some of the problems arise. Over here on the right, I've got the reasons for mortality that you have recorded. Number 1 reason for sow mortality in the farrowing crate, no reason, okay? Which is a bit of a bummer, but it's real. Of course, we don't always know why the sows die, and I'd rather have you answer no reason than try and guess wrong and create data that misleads us. So that's the reality. Number 2 reason for sow mortality in the farrowing crate, sudden death. And then the number 3 reason, and this is what we're going to hone in on in a few slides, vaginal and rectal prolapse put together are the number 3 reason. Okay? Going to just jump ahead and show you the exact same information for the dry sow barn. And again, it makes sense if you look at that chart in the top left-hand corner. Most dry sows die right at the end of gestation. Of course, they're carrying a huge heavy litter inside them. It's very stressful. And if you've been, feeding and nurturing a sow out in the dry sow barn, sometimes you realize, you know what, the sow can't go down to the farrowing barn. We have to euthanize her. So that comes in there at the end of gestation sometimes. Number 1 reason for mortality in the dry sow barn. Anyone want to guess? No reason. Same as in the farrowing barn. Makes sense. We don't expect you to be veterinarian. Sometimes we just don't know. Number 2 reason, sudden death. Same as in the farrowing barn. Number 3, lameness. So that's a bit different, but you all see that. The sow with the bad leg that just can't survive in the dry sow barn, especially maybe in loose housing. So we're going to talk more about sudden death, lameness, and then prolapses. There are lots of things that can cause sudden death. I've listed a small little list of bugs here. Some of the other vets might not agree with me, but there are some bacteria here. Glasarella, Glasser's disease, Lawsonia, that's ileitis, and even Mycoplasma. Those can cause a sow to die very suddenly without a whole lot, if any, clinical signs preceding death. And those are diseases that we have to have under control on your farm. We have to have them under control. We can't get rid of them. It's not possible to have a farm that's negative for the first 2. Mycoplasma it is, but not the first 2. But they have to be under control. And if on your farm sudden death is the number 1 cause of dragging sows out the back door, if we want to say that, then we have to make sure that these diseases are under control. Then there's some non-infectious stuff here that's a lot harder to understand and control. So we get our twisted bowels, or we get our twisted stomach and spleen all wrapped up together in there. Or if it happens right around farrowing, we'll have a uterine torsion sometimes, or the rupture of the uterus and the sow bleeding to death. Those are less common causes of death, but in particular the twisted bowels and the hemorrhagic bowel diseases, sometimes those really occur as outbreaks, and they're hard to predict and therefore hard to prevent, and they can be significant. But what I really want to say is that when we're recording sudden death as a cause of death, let's make sure that that's true, okay? So an animal that we're writing down died and it was a sudden death. Should that animal have been recorded as having had a treatment the day before? Probably not, right? That's not a sudden death. That's a sick animal that didn't respond to treatment. It's a little different. It's going to lead the vet down a different pathway. If we got a sow that has shown up for 2 or 3 days on our electronic sow feeder as not eating, and then she goes on to die, is that a sudden death? I mean, she was alive one moment and then she wasn't. So I guess death is always sudden in that way. But if she didn't eat for a few days, that's not a sudden death. We probably should get that into the system as something else. So really, I'm just encouraging you to be careful when you and your staff enter sudden deaths. If you're having a lot of real sudden deaths, by all means, phone the vet. Let us help you figure out what's going on. And especially if it's infectious disease, we can work on that. But if it's a sow that's actually sick for a little while, then let's make sure we record that accurately, okay? And it completely depends on the quality of daily sow observation. It's not common, but it does happen where I'll come into the barn on my once a month or once every 2 months visit, and I will find sows in the dry sow barn that are sick, and I'm the first one to find them. And it shouldn't be that way, right? Your staff are there every day, you're there every day, so don't wait for the vet to come to find the sick sow. Your staff can do that. Sometimes they need help training, but they can do that. You know, lameness can be the #1 cause of mortality on some farms. There's lots of reasons why sows get lame. There are infections, and I won't go into the names of them all, but they do exist. There is trauma. You know, these sows are hard on each other, sometimes especially in a group. They can be jumping, they can be running, they can hurt themselves. The flooring of our barns is challenging. It's cement, right? It's hard on the feet. In addition to that, we know that it is so important how we grow our gilts. You get a gilt growing too fast, and you're at risk for OCD, osteochondrosis dissecans. It's a condition that really weakens the part where the two bones meet together in the leg, and that can be devastating for a herd and for that animal. And lameness is a very costly disease. A recent study here summarized at the bottom of this slide. If you are walking your sows from your dry sow barn down to the farrowing barn, and you've got a sow with an arched back or a limp, or it could even be a sow that can't put weight on one leg on the ground, that sow has a higher chance of not farrowing, even if you can get her there. She's going to have higher stillborns. She's going to have higher pre-weaning mortality. She's going to be at higher risk of dying or being culled before she gets a chance to wean those pigs. So preventing those lame sows is a key on keeping the herd highly productive. I want to thank a producer in this room who shared a couple pictures with us. And on their farm, they have this amazing 30 by 30 bedded pack. Okay? There are some biosecurity issues that you would need to address to do this on your farm, for sure. But that bedded pack saves sows. There's 4 or 5 pregnant sows in there that on most farms would need to be euthanized. They would never walk to the farrowing room. But on this farm, those sows, you know, spend a few weeks in the Ritz-Carlton, and they get better, and then they go farrow, and we sell those piglets. It's kind of old tech, but it's amazing. The picture on the right-hand side here, I don't know if you can see it at the bottom, just a little bit of stainless steel welding, a little extra bracket at the bottom of that farrowing crate. They don't have them in all the farrowing crates, just a couple. But a sow that's slipping and sliding with that splay leg, long, curly toes, they put them in those crates, and it provides just a little more stability for that sow to get up and down. So there's some things we can do with lameness as well. I just want to come back to a comment I made a minute ago and just talk very briefly about this question of housing and sow mortality. And I already showed you that in Ontario, at least, you guys have developed the expertise to keep sows alive in loose housing or stalls, and that's great. But there's still a lot of questions about what is the best type of loose housing to limit sow mortality. And the science is not at all consistent on this. there's not a consistent story that electronic sound feeding is better or worse than stalls. There's not a consistent story that dynamic groups, which are larger groups often, are better or worse than smaller or large static groups. There's not consistency on when we mix the sows, right after breeding or after preg check. There's not even consistency on square footage. There are some farms where the square footage is very low and the sow mortality is very low. And group size also not consistent. What am I trying to say? I'm trying to say that an expert team of pig farmers can manage and succeed in any system. So if you've still got your loose housing transition in front of you, don't worry. You will be able to succeed. Ask as many questions as you can, build the best system you can, but don't worry, you'll be able to succeed. The transition is generally difficult, okay? And so there's many individual farms, and some of you are in this room that have had a real rough ride transitioning to loose housing, especially when we've got an older barn that we have to renovate. But you can succeed. And then we're just at the front end of this, right? I mean, our grandparents had sows in loose housing, maybe out in the pasture even. But this is all new for us. And of course, we're doing it at a bigger scale with different genetics than they were. So there's a lot more epidemiological information. Applied research needs to be done to help us really, really hone in on housing and mortality. But to get to the main point of the talk, I want to talk now about pelvic organ prolapses. And this is probably a slide you've seen somewhere before. This comes from the Pig Livability Project down at the University of Iowa. And they have 104 farms here on this chart, and they've got them ranked from highest to lowest annual sow mortality. And yes, those highest farms are way over 20% annualized sow mortality. And the little kind of gold color is the mortality due to prolapses. And on some farms, they have up to 10% sow mortality just due to prolapses. So if you have 2,500 sows, that's 5 prolapse sows every week that you're pulling out the back door of the barn. It's really a devastating problem, especially because it seems to have come out of nowhere and nobody knows why, okay? It's a new problem. They have been working hard on this problem at Iowa State. This slide comes from a fellow named Jason Ross, who's devoted his expertise and his grad students to trying to understand what's going on. And it's interesting because a whole bunch of risk factors, which seem intuitive for pelvic organ prolapse, are not related. Herd size is not related, and I'm looking at that red section of the graph there. Whether or not we induce the sows appears to not be related. If we use an internal exam of the sow during farrowing to help her farrow, that's not related to pelvic organ prolapses. Neither is the tail length of the sow, even though we know if we get the tail too short, we can mess up the innervation, the nerves going to the back end of the sow. Particle size of the feed, I wouldn't have thought to ask that one. It's not related, so I didn't have to ask it. Let's jump down to the bottom here, the green section, because I want to just talk for a minute about the farm level risk factors that are related to the risk of pelvic organ prolapse. So water quality, that's a weird one. Farms that treat their water have fewer pelvic organ prolapses than farms that do not. Okay. Body condition, so farms that either have really, really high body condition or really, really low body condition, they're at higher risk than farms that have normal body condition. Farms that bump feed actually seem to have less pelvic organ prolapses. Interesting. And then farms where we have a whole bunch of sows with a bad perennial score, they have more prolapses. I'm going to go into the perennial score more in just 1 minute here. But pigs are not the only species that can get pelvic organ prolapses. In fact, other mammals can, including people. When you look at this problem in people, the #1 risk factor by far is chronic constipation and straining, okay? And I have done this myself where I walk into a farrowing barn and there might be a sow with a prolapse, and I look at the manure coming out of the sow and it's nice and soft. I look around the farrowing room, I step on the manure and I say, oh, that's nice and soft. No constipation. I think we may have been missing the point, and I'll explain what I mean in a slide or two. Just to complete this slide though, other risk factors for pelvic organ prolapses in people, difficult labor and delivery. Yeah, That makes sense. We've all seen that with sows on our farm at least once. High number of deliveries. That's what we say in people. In sows, we call it parities. And yes, older parity sows do tend to be higher for prolapses. Family history, okay? That's a factor. And yes, we are now realizing that the heritability of pelvic organ prolapses is a little higher than we thought it was. And then weak pelvic floor muscles and or connective tissue, and there's a few reasons for that. Just hold that thought and we'll carry on with that in 2 slides. Okay, this is a picture of a sow cut in half, looking from the side. Just to remind you, we've got the rectum, so the end part of the digestive tract on top. Then below, we've got the female reproductive tract, including the vagina and the uterus, both of which can prolapse. And then underneath that there, you can see the urinary bladder. That can also prolapse. That's what it looks like from the side. On the left-hand side of this picture, this is what it would look like if we cut the sow in half and looked towards the rear end of the sow. And what you're looking at there is the musculature of the pelvic floor, okay? And the rectum and the vagina and the urethra coming from the bladder all go through little openings in the muscles of that pelvic floor. That muscle is required to be strong and fit to prevent prolapses, okay? If that muscle is not strong and fit, when the sow strains, either during the process of farrowing or manuring, everything's gonna come out, okay? Now that muscle is skeletal muscle. And if you have a sow in body condition score 1, and I'm showing those types of sows here in the chart on the right-hand side, that sow does not have very much skeletal muscle. And we can see that by looking at her from the outside. But you can rest assured that the pelvic floor of that sow is also weak. And that sow, therefore, is a really high risk for a pelvic organ prolapse, okay? So what do we know we can do today? Well, I think it's critical to prevent huge swings in body condition and to prevent skinny sows from showing up at the farrowing room at farrowing time. And this is especially tricky with gilts because we will look at gilts that have, maybe been on full feed at some point in their life. Maybe we didn't get them bred on the first heat cycle because, we're supposed to skip them. That's what the genetic companies say. Or maybe we didn't get them bred for a long time because we had trouble finding them in heat. They might enter gestation big and heavily conditioned. Do not underfeed those gilts because if we underfeed those gilts during gestation, they can actually lose condition or weight and they can arrive in the farrowing house with decreased skeletal muscle, including pelvic floor. I got to show you that perennial score chart. I thought that was prior to now. I'll have to come back to that. But the point underneath this is really important. Prevent chronic water intake suppression, okay? The genetics companies have studied this, and they're saying that a sow in the latter part of gestation would like to drink 35 liters of water per day. That almost defies understanding, right? That is more than 10% of the sow's body weight as water. Think about drinking that much water yourself. It's a lot of water. But they've studied it, and we know there's a lot of individual sow choice and that it is very often linked to the temperature outside, but that's what some sows want. So we obviously know a sow can survive on much less water, but can a sow thrive? And as I've looked at this problem and talked to many of you about it, I'm convinced that we don't offer our dry sows enough water. If you have your sows in a stall, a 2-foot wide stall with a 6-inch deep wide trough, and you fill that trough with 2 inches of water, that's about 4 liters of water, okay? So you would have to fill and refill that trough 8 times a day or more to meet that sow's need. Now that can be done with a float or with a timer system. It can definitely be done, but I'm convinced there's lots of sows that don't get nearly that much water. And in our big electronic sow feeding pens, where the sow gets a little bit of water when she eats, and then she maybe gets a bit more water when she walks way down to the other end of the pen, and then she has to go lie down for the rest of the day, I'm convinced that in some cases we're not offering enough water. So please, if you don't take anything else home, go home and think and talk to your team about water for your dry sows. I think we haven't been paying enough attention to it. I think we have chronically constipated sows, and the constipation has stretched and strained that pelvic floor to the point where it can fail. Okay, we're going to get into our little research project here because we got talking about this with some farmers, some really smart farmers, and we said there has to be a way to fix a pelvic organ prolapse once it happens. How can we do it? So surgery is an option, and what I mean by surgery is when you got a rectal prolapse, you can put a band around it, right? There's a prolapse tube with a band, and that actually works pretty good for rectal prolapses. A lot of those cases, if they're treated properly, can go on the call truck. It's not very easy. It's dirty, hard work. It doesn't feel like it's great for the sow's welfare, and it doesn't work at all for a bladder or a uterine prolapse. So it's got limitations. We thought, what if we tried a different approach using some medicines? We weren't aware that anyone had tried this, but we thought, let's try it. So why does the sow keep straining and pushing when she's starting to have a prolapse? That can drive you crazy, right? When you see a sow sitting there starting to prolapse and you can see her pushing, you just say, stop. Why don't you stop? And the reason that they don't stop is because it's a reflex. Swelling and pain inside the pelvis make that a reflex. That sow can't stop. So we asked ourselves the question, can we help her stop if we take away the pain and the swelling? Okay, so that's what we tried to do. We used anesthesia inside the pelvis to take away the sensation of pain, which causes reflex pushing. And then we took away the swelling, again, inside the pelvis, which was sending the signal to the sow, something's in the pelvis, push it out, okay? So we've got the whole treatment protocol there, but if you just hang on tight, I'll show you in one more slide how it worked. I'm sorry, I got this a bit out of order, but have a look here at these pictures. This is perennial score 1, 2, and 3. And over here, perennial score 3 with the big bulge at the back end, those sows are 8 times more likely to prolapse than score number 1 at the far end with the nice normal looking vulva and rear end. So if you've got a sow with that big bulging vulva prior to farrowing, we're strongly recommending that you try this protocol because that one is going to prolapse, okay? So we worked with the farms who were involved in this trial. Thank you very much for participating. And we said, if you've got a sow pre-farrow that's bulging like that, perennial score 3, or you've got a sow that's just farrowed and it was a brutal farrowing, or it was a normal farrowing, and she's got a little bit of mucosa peeping out the back end, then treat those sows, all right? Okay, our little video is working, and what we're showing there in the video is washing the protruding tissue with cold water, which was step number 1. And I'll just keep talking as that video keeps running. After we washed the tissue with cold water, if necessary and if able, we replaced it. We put it back in the sow where it belonged, okay? Then we applied xylocaine, that's the freezing, that's the anesthesia, which takes the pain away. And we did that by putting it on our glove and putting the glove inside the sow. I think you'll see that on the video in a moment. So the xylocaine is the pain treatment, and that's applied internally. We essentially froze the inside of the sow's pelvis. After that, we administered this drug called Salix. And Salix tells the kidney to filter more water and get it out of the sow. And as that happens, swelling in the sow, in any part of the sow, is actually reduced. Of course, in this case, we were most worried about swelling inside the pelvis. In addition to that, we gave dexamethasone, which is a bit more of a long-term painkiller and swelling-reducing drug. And then we recommended that if this was successful, we did identify this sow as one to be culled. They can recover so well that you want to breed them back because they look normal, but we suggest you don't, because the risk of prolapsing again after having prolapsed once is really high. Okay, so I think you've seen most of that in the video now, but that was the protocol. How did it work? Okay, so we had 13 herds put up their hand and say, we're pretty sick of prolapses, we'd like to give this a try. Send out the products and we'll be part of your trial. There were various sizes, various housing, and various genetics. We received information back on almost 70 sows, 69 sows that were treated with this protocol that you just saw in the video. And 65% of those sows went on to survive, raise a litter, and then get culled, okay? Which is obviously much better results than doing nothing. And even in the case of rectal prolapses treated by that surgical method that I mentioned, a very good success rate. I won't go too deep into these details because I know you can't see them all. But you know, the pigs that recovered and the pigs that didn't recover from the treatment were pretty similar, except for one thing. The ones that recovered were the ones that we found sooner. So if we could treat them prior to farrowing, when we were looking at them and saying this sow is going to be a problem, that worked better than if we waited a day or two until after or during farrowing and we said, okay, this sow is a problem now. So early's better. But yeah, our recovered sows lived for an average of 21 days in the farm as compared to only 2 days for sows that did not recover. But this is very interesting here, okay? I want to focus on this slide for a moment. We have 13 farms here. The farm that treated the most cases treated 11 over the summer. And you can see, I think you can see, I hope you can see, that some farms had 100% success rate. Other farms had lower success rate. Some farms had 100%. And I know some of these farms and farmers personally, and I think the key is good daily observation of sows and pulling the trigger really fast to apply the treatment when they think a sow's in trouble. If you've got a sow that has a 1-foot uterine prolapse hanging out the back of her, that sow can be saved with this protocol, but not all the time. Whereas if you've got a sow with a bulging perineal area that hasn't farrowed yet, the results can be very, very good. Here's just a picture of a sow before and after. So this sow had a perineal score 3 for sure. She had farrowed, and as she was expelling the last remnants of placenta and fetal tissue, she had peeping mucosa. She was treated with the protocol, so the xylocaine, the freezing in the pelvis, and then the Salix, and then the dexamethasone, and then just a couple pictures of the back end of that sow afterwards. So that sow raised a litter and was fit and healthy when it came time for her to be culled. So if there's any questions about that protocol, we'd really be happy to answer them. I've been very involved, but some of the folks you see up here at the front table have also been very involved and are very knowledgeable about what we've been trying to do here. And again, I really want to thank the farms that participated and gave us feedback. I just wanted to end too by letting you know that you can expect to hear from us again on sow mortality. You know, as I said, it's a global news story, and it ain't a good news story for the pig industry. And so Ontario Pork is very aware that they need to be devoting resources to understanding the problem of sow mortality, such that as it is here in Ontario. And Southwest Vets are eager to work with Ontario Pork and researchers from the University of Guelph to dig into the problem of sow mortality, because we really feel like the people who have the answers are right here in front of me right now. So we want to work with you, understand what you're doing on your farms, understand your data, and use that to generate more information and also to tell the good news story about sow mortality in Ontario. We're bucking the trend. Personally, I think it has to do with really engaged owner-operators and really well-trained and keen staff. So thank you very much for that. And we've got a good story to tell about the adaptation to loose housing. It's not easy, but it's working. We still have unanswered questions. And so if you hear from us and we ask for your help or your permission to share your story, please say yes, because we think we got a great story to tell. I just want to say thanks to a big team of folks at Southwest. Some of these you've met today. Courtney, you've met. Jillian, who couldn't be here, and Natasha, and Paul, who couldn't be here. They were all instrumental in this project as well, as was Shalimar and Bettina and the rest of the vets. But mainly, thanks to you, our clients, for helping us understand this problem of sow mortality. That's all I have. Do we have time for questions? Okay.
So Greg, with these higher mortality of sows, are we ramping up to do more post-mortem work on these sows?
Yeah, thanks very much for asking that question. The question was, with higher sow mortality, some of it unexplained, are we ramping up to do postmortems? And yeah, it's hard to do postmortems on sows because we want to make sure we get into your barn cleanly, you know, and so if you phone us and say, hey, I got a sow mortality that I need to investigate right now, we have to make sure we're clean and can get there. But we got a big team on the road now. And so yes, if you've got unexplained good sow found dead or a series of them, yeah, let's open some of them up. We'll send someone out who's clean and capable and do some testing. At the very least, to knock those bad infectious diseases off the list.
All right. Thank you, Greg.